So after the 2 minutes wash back, you have the option if you want to give an extra rinse back. So press that and it will tell you, for example, you want to give 50 mils extra rinse back, it will tell you there. If not, just press it back again and then you could proceed to disconnecting the patient. So disconnect, press disconnect patient, confirm. So now you're going to disconnect from your vascular access. So connect this to any of the available lines just to keep it a closed system. From your machine again, it will tell you again what to do, how to unload your cassette. So it says on your first line, to perform dialyzer emptying, rotate dialyzer holder, blue label on top. So this is our dialyzer holder, just rotate it up. And then it says attach blue dialysis fluid connector to the machine. So we're going to put back the fluid tubes that we removed when we lined the machine. So remember, press and pull, press and push. So what it's doing now is you could see the dialysis fluid emptying from your dialyzer. So you could hear that gurgling sound. Once that fluid has gone through, put back now your red fluid tubes to the holder. Okay? Once that's gone through, go back to your screen. And it says unload cassette. So there's boxes there which says unload cassette. If you press that and then confirm, then follow the next instruction. Wait for the arterial pump to stop. You've heard that clicking sound. That's it. That's when the arterial pump had stopped. And now you're going to open your sensor bar. Going back to the sensor bar. We open that up. Next line is remove patient lines from clamps. So these are patient clamps. Once you've done that, the cassette will automatically get pushed out. And then we wait for the next instruction. So now the machine is happy for us to open the arterial pump cover. Open it up and then remove cassette from cassette holder. We close the sensor bar door, we close the arterial pump door, and then we discard the set as you normally discard your sets. So now what we're gonna do is, it says on your screen, cartridge draining in progress. So what that's doing now, it's emptying your bicarbonate. And now what you can do is put back now your acetate to its original position. So we disconnect this from the connector. And it goes back to its original position. Just make sure when you put this back in that it clicks to its original position. Make sure it's securedly click in. Going back to your screen, it says remove concentrates. So your concentrates are your acetate and your bicarbonate. So we're going to remove now the bicarb. So once you remove your bicarbonate, you have to close your bicarb arms so that your countdown will go to 15 to 0 so that you will be able to start disinfecting your machine. So to disinfect our machines, just to be on a safe side, we'll double disinfect them. So we have 2 disinfection cartridges that we use. We have a clean cart A, which is the sodium carbonate, and a clean cart C, which is a citric acid. So to disinfect them, we have to do the A first and then the C. So don't exchange them. It should just think above your alphabet. So A first before C. So put your clean cart A is the same way how you put back your bicarbonate. so it doesn't matter as well which side. So we're gonna put the clean card. So open your bicord arms. So remember the out and up. Make sure this gets punctured properly, because if it doesn't, you might have an alarm. Just make sure that's properly punctured on both ends of your cartridge. Then going back to your screen, if you press disinfect rinse, you go to process type selection. So we have both clean card A, press that, confirm, and then you have to activate, because if you don't press that, it will not start disinfection. And then close, and then you could see how long the machine will go to disinfection. Once your machine is on disinfection, your straw, just remember, just run this through tap water just to clear the remaining acid, otherwise this will crystallize. So after you've run this through water, make sure you put it back to the holder on the side of your machine. If you have remaining fluid from your acetate, this just gets drained out through your sluice. Cleaning the machine, just use your normal, I think, Cleanel wipes that you normally clean the machine for. Just be careful when you're cleaning the machine that you don't clean these sensors, because this has got a special cream that the engineers put on so that the sensors will measure the pressures correctly. Screen cleaning, we have to be very careful, and you want to make sure that we don't damage the screen of the machine. So there's a special way of cleaning the screen. So on your knob pad, go to your notepad, and then on those boxes there, you can see the screen cleaning. So if you press that, and it says the screen will become unresponsive for 12 seconds to allow cleaning, and then press confirm to clean. So once press confirm, you have 12 seconds to clean your screen. After 12 seconds, you just go back to your main screen again. And that's your machine.